Okay, now I'm going to show you all how to do piggyback, IV piggyback. Just the middle part, just how to hang it. So we've done all of our checks in our med book, and we're giving levofloxacin. That was in our order from the physician. You don't have to put on, if you have washed your hands thoroughly, I don't think that they say you have to wear gloves, but I just like to wear gloves for everything. So for this skill, I'll put on my non-sterile gloves. I've gathered my supplies. My supplies are my secondary tubing, my med that I've already checked twice when I've got it out of the Pyxis and then against the book. Levofloxacin, it's in 50 milliliters of normal saline. And so we're gonna hang that piggyback. All right, I'm gonna go ahead while I'm right outside of the room and spike it. I've done all my checks, right? Patient dose, route, time, drug. And the first thing you do when you get out piggyback tubing, secondary tubing, is clamp it. Because you do not want medicine to start flowing through. Now, once you get to be a seasoned nurse, you probably know how to unclamp it and then clamp it back really quick. But for now, we're gonna keep it clamped. All right, so you undo the port. Put your med, or put your piggyback in there, and it's the port that's open, not this port that looks like it has a stopper in it. Not that port. You put it in this port. That's hard for some people. Okay, levofloxacin, and then I've got a couple alcohol preps. And when I go into the room, I'm gonna look at the MAR. Hey, Mr. Stone, how are you doing today? I've got your antibiotic for you. And I'm looking at the MAR, and the MAR, I'm gonna check it again against the MAR for my last check before I hang it. I've looked at his IV, I've done all that. For time's sake, I'm just kind of doing the middle part. All right, so I'm going to clean this blue tubing, or this blue port, for 15 to 30 seconds. And you've got this clamped, so you can undo it, undo the tubing, and hook it up, and hang it. And then, when it's hooked up, you can unclamp it, squeeze a little bit into the chamber. All right, so then all you're gonna do is press the B line. Press B, it says piggyback. We don't know how many milliliters an hour we are going to infuse. All we do know for sure is that our bag had how many milliliters in it? 50. And we looked it up in the drug book, and the drug book said you infuse this antibiotic over 1 hour. So then we scroll down again, and we put a 1 in the hour mark. And that gives us our rate per hour. So it's 50 milliliters per hour, because our volume was 50 milliliters, and then our rate was over 1 hour. So we've got 50 milliliters an hour. Okay, so I've got all that, 50, 50, and then 1 hour. And I just realized something. I forgot to bring my drug label into the room, and not the drug label, but the when we change out the medication line, when we change out the tubing. It's every 24 hours. The secondary tubing is every 24 hours. So I put a change Friday because today's Thursday. All right, so there we have 50 milliliters an hour because our total volume is 50 milliliters. Duration is over 1 hour. And we can either push start and wait for it to pull air, and then it will start beeping on us, and that's when we back prime. Or we can press stop in the very beginning, and then that causes it to pull up back prime. So either way works. But I'm gonna have it so that it pulls air and it starts beeping on us. So it starts pulling air, and in just a second, it'll start beeping on us while I'm throwing my stuff away. It takes just a second. Then I've thrown my stuff away, and I'm gonna wash my hands again. And it takes a while, so it might be easier to just push stop at the very beginning to back prime, but So it starts beeping because it's pulled air, because this was filled with air. So right here in the corner it says back prime. So you are going to back prime it until there is no liquid, or sorry, there's all liquid in this tubing, so that it's not pulling air. So what you're doing is back priming from the primary, you're pulling that fluid up into your secondary. And then you're going to push B again. It's 50 milliliters per hour, 50 total milliliters over 1 hour. Start. And then it says continue. Yes. Even though line A is not running. Yes. So now just B is going, and it will go for 1 hour. And that is how you do piggyback. Then you throw your stuff away, you wash your hands, and you will come back and check on him.